Hello everyone, my name is Jacqueline Torres and today I will be educating you on rotator cuff syndrome. The supraspinatus is one of the muscles of the rotator cuff that is commonly injured. The shoulder joint is made up of 4 joints involving the sternum, clavicle, ribs, scapula, and humerus. These joints allow for motions of reaching, throwing, and grasping. The glenohumeral joint is a ball and socket joint of the shoulder where the greatest motions occur. It is made up of the head of the humerus that moves inside the socket of the scapula. This joint has 3 degrees of freedom. These include flexion and extension, abduction and adduction, and internal and external rotation. When the arm is moved away from the body, the rotator cuff tendon helps the head of the humerus rotate and stay inside the socket of the scapula. When the shoulder moves, the muscles surrounding the scapula work together as a team. As the muscles of the scapula contract, the scapula rotates and moves out of the way. When the scapula rotates, the rotator cuff tendon has enough space to move. When muscles of the shoulder and scapula do not cooperate during a single motion, instability of the joint can lead to injury. The space between the humerus and scapula is reduced, resulting in compression of the rotator cuff tendon. Over time, the rotator cuff tendon can tear. The main symptom of rotator cuff syndrome is pain that runs down the front and middle section of the upper arm. The pain occurs gradually and is more intense at night. Rotator cuff syndrome can be caused by poor posture, weakness or tightness of the muscles surrounding the shoulder, inflammation of the joint capsule, excessive wear and tear of the rotator cuff tendon. Pain is usually associated with activities that require overhead reaching, such as combing your hair. Patients with chronic shoulder pain should seek the services of a healthcare provider for appropriate evaluation and treatment. A physical therapist can perform physical examinations to identify the presence of rotator cuff syndrome. Treatment for rotator cuff syndrome can include medications prescribed by a medical doctor to control the pain and inflammation. A physical therapist can prescribe exercise conditioning to improve control of the rotator cuff and scapular muscles. Stretching exercises to target tight chest muscles, and educate patients on appropriate posture. The rotator cuff tendon is commonly subject to injury. The compression forces produced by poor posture and muscle imbalance can lead to severe pain and disability. For best treatment outcomes, early management of shoulder joint pain should be done by seeking the services of a trained specialist.